Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan of the Allegheny County Health Department, here to give our weekly update on COVID-19. Obviously, we're on the other side of Labor Day. Summer is over. Schools are back in session, one way or the other, both elementary through high school, on through the colleges. Dr. Bogan will be reporting on some of the numbers, but certainly we've seen the results. The percent positivity has started to head up a little bit over the last week or so, and it's probably something that we kind of expected as the 85,000 college students head back to class, along with school activities, sports, extracurricular activities at the school district level. And then obviously there's going to be a change that the governor announced this week that'll take place on the 21st, dealing with restaurants. So it's a lot of challenges, but again, if we're continuing to socially and physically distance, wear our mask, pay attention to the experts' advice, medical experts' advice, we can hopefully, continue to keep our numbers within range. A couple of announcements to make, and then again, Dr. Bogan will come in and talk about a lot of the other things of testing and where they're going. But we want to announce that Allegheny County will be opening a COVID-19 testing site in McKeesport, which will begin testing of the public next Tuesday, September 14th at 10 a.m. And I want to thank our elected officials in that region, Congressman Doyle, Senator Jim Brewster, State Representative Austin Davis, County Councilman Bob Macy, and Mayor Shrepko, Mayor of McKeesport, for all their cooperation and advocacy for making sure that folks in the Mon Valley are able to get tested. There's a lot of partners that came together with that, and I want to thank them. But the free COVID-19 testing for all ages is made possible by the CARES Act funding, and thank you, Congressman Doyle, for that, along with your colleagues, that has been allocated directly to the county with support from the state. The build-out of the site is at 455 Industry Road in McKeesport, and that began yesterday. Actually, the work began. Many of the partners who have assisted us in this effort are the Pennsylvania Department of Health, the Pennsylvania Emergency Agency, PEMA, and the Pennsylvania National Guard. Thanks to all of them. The RADC, who it's their land that it's going to be located on. The Allegheny County Emergency Services, Matt Brown and his team, Emergency Management and Fire Training Academy, which have taken the lead on the setup and management of the site. The PA Region 13 Task Force, EMS West Special Medical Response Team, and Pittsburgh Emergency Management. Locally, with our friends from McKeesport, the McKeesport Police, McKeesport Fire, and McKeesport Area Rescue Service, and any other county departments that have been part of this, including Public Works, Facility Management, and Human Services, along with County Manager McCain, coordinating all of this, and of course Dr. Bogan, who's very instrumental in making sure that the communities in the Mon Valley, not just McKeesport, but all their adjacent communities, who can have access to this as well. So with that, let me turn it over to the department head, the head of the Allegheny County Health Department, Dr. Deborah Bogan. Dr. Bogan.
Thank you, Rich, and thank you all for joining us this afternoon. As the county executive mentioned, I am excited to have this testing site opening in McKeesport next week. I want to thank the many partners from across the county and state who have come together to make this testing site possible. We chose McKeesport not because there's an outbreak in McKeesport or the case numbers in McKeesport. We chose McKeesport because the health department wanted to make sure that testing was available to residents in that area of the county. We've heard that residents in the Mon Valley didn't feel they had adequate access to testing, and we hope this site addresses that concern. We do ask that you pre-register for testing, and we will provide instructions on how to register for a test later this week. Tests are free and insurance is not necessary. Tests will be sent each day to the state's laboratory near Harrisburg, and results will be available within 48 hours. Testing will be available for people who have symptoms of COVID-19, who have been in contact with someone that has COVID-19, who works in a nursing home or a long-term care facility, is a critical infrastructure worker, healthcare worker, or first responder, are a high-risk patient and have recently attended a gathering of 10 or more people, or live in a shelter or single-room occupancy. More information on the test site and a link to register for testing will be available on the Health Department's website by Friday afternoon. The first day to register will be Monday, and the first day of testing will be Tuesday. The site will be open after that Monday through Friday from 10 a.m. to 4 p.m. This test site really comes at the right time for our county. As we enter the fall and schools and universities reopen, we must have broad access to testing. The McKeesport test site fills a gap in testing access for our community, including testing of children as young as age 3. This test site came together with hard work, collaboration, and coordination across many organizations, as the county executive described. So thank you all to those of you who are making this possible. Today, I'm also announcing another service for Allegheny County residents that aims to answer many of the questions and concerns surrounding COVID-19 and schools. Getting children back to school safely has been one of our top priorities over the last couple of months, and providing consistent and up-to-date information is a key part of that. The Health Department, the United Way of Southwestern Pennsylvania, the Pittsburgh Poison Center, and UPMC Children's Hospital of Pittsburgh Nurse Triage Line are partnering to add on-call nurses to the resources available through 211. These nurses can answer questions from physicians, school administrators, teachers, parents, etc. The service is further supported by UPMC Children's Hospital, Allegheny Health Network's Pediatrics, Sewickley Valley Pediatrics and Adolescent Medicine, Kids Plus Pediatrics, Pediatrics South, and Children's Community Pediatrics, who will make physicians available to assist the nurses if they need additional advice. Calls to 211 specifically about schools will be sent to a team of nurses who will return the call with a consistent guidance and most up-to-date information. I want to be clear, this line is not for specific questions about a child's health or a case of COVID-19. Parents with questions about their own child's health should contact their pediatric healthcare provider, and school administrators who have questions or information pertaining to a specific case of COVID-19 should continue to contact the health department directly. The nurses will be available from 8 a.m. to 4 p.m., and calls during this time will be returned in as little as 20 minutes. Calls outside these hours will be returned the next day. I hope this line will be a valuable resource to provide guidance to pediatricians who may be fielding calls from families, to answer questions about safety protocols and procedures from school administrators, and to respond to questions and concerns from parents. And before I conclude, I want to thank Jackie Stebler for my beautiful mask and the mask she made and sent to me last week. Ms. Stebler is nearly 90 years old and lives in Greenfield. She has made more than 1,000 masks for her family, friends, and community. She decided to use her stimulus money to buy materials and supplies to make the masks. And she can be seen handing them out free of charge to people in her neighborhood and while she shops. Jackie, like public health officials across the world, knows that face coverings will protect her and the people she loves from spreading the virus. So, to protect people like Jackie, we must all continue to wear face coverings when we go out. It is one of the key tools we have to slow the spread. So thank you, Jackie, for sending those beautiful face coverings. And to all of you, please remember to stay home if you're sick and get tested. Limit your trips out of the house. Wear a mask if you do go out. Stay at least 6 feet from others and avoid large crowds. And wash your hands or use hand sanitizer often. Thank you all. Stay safe and be kind.
For members of the media listening, please switch to Facebook. We understand there's a problem with the audio and that you haven't been able to hear the last portion of the press conference. We do apologize. The first question we have is from Public Source. In her pitch for Pennsylvanians to get a flu vaccine, Department of Health Secretary Dr. Rachel Levine yesterday said that there were 102 deaths, including one child who died of influenza last year. Can you tell us how many died in Allegheny County last year and how many were hospitalized or diagnosed in 2019?
Sure, yes, thank you. So we had 15 deaths here in Allegheny County from influenza, and we had 177 hospitalized. And we had over 13,000 cases reported. Again, that's probably a huge underestimate because influenza isn't a mandatory reporting, so we get the best data we can from various sources.
This next question is the number of tests is really low, which shows a high positivity rate. Should we be testing more?
Yeah, we did definitely see a decline in testing over the long weekend. It's possible that we will see that there was actually more tests come and they come in late, but so far we've been seeing a pretty steady turnaround. And I think that just reflects that people were choosing not to get tested, not from lack of availability. I expect the test numbers will go up over this week. And again, my hope is that anybody who has symptoms of COVID-19 is getting tested and that all of the close contacts of those people are also getting tested. Again, we're opening this test site so there will be ready access for anybody. And I think, again, it's vitally important that people who have concerns about COVID-19 do get tested. So again, you can use our county website, has a map that lists all the sites. You can also call 211 and the folks on the phone at 211 will help you find a test site near you. So please use the resources out there if you need to be tested.
This next question is from WPXI. Dr. Bogan, yesterday the governor announced a change in the capacity, for restaurants, increasing it from 25 to 50%. Do you agree with that move?
So far, our data support that move just fine. And again, we don't currently have in the county an order around restaurant size. That has been under the governor's order from our last order. So as of September 21st, as again, we've been on the governor's order related to restaurants, we'll continue to do that at this point.
This next question is from WTAE. Do you think there will be a time when restaurants can increase capacity to 75%? And many restaurants are losing business because bars are closed. Will there be a time when physical distancing measures or masks are allowed at bars inside of restaurants?
I'm really, that's a question for the state.
This next question, are the universities testing and are their results reflected in our county numbers?
As I said last week at this event, we were struggling with the out-of-state addresses being used. And again, when somebody uses an out-of-state address, it doesn't go into our NEDS database, which is how we find out about cases. We have been working with the universities. They've been very helpful in trying to address that challenge and to communicate with us about their cases. We continue to improve on that process, but it is definitely improved and we're getting better and better information from all of the universities at this point.
A related question from WPXI. Today's average age of the new cases was 21. Does that mean that we're seeing more cases in college-age students or college students?
That the number of positive cases between ages 19 and 24 has definitely increased. And so yes, it does reflect, just like we saw at the beginning of July, sort of a younger age group. I think that's what we're seeing again at this point.
And this final question from Pittsburgh Business Times. Are you seeing an impact on COVID positivity rates in cases with a return to school? What would be the key to making sure there's a handle on those cases and that we don't see a spike in the next several weeks?
So again, schools have really just started to go back. Many schools are doing partial hybrid programs, some are in person. Again, it usually takes about 3 weeks to see an increase in cases when you make a big change. So we haven't started to see that yet. We are working really closely with the schools, both with Pittsburgh Public and with the AIU. We're in constant communication. And so if we started to see something, we would respond right away and work with them on issues if we saw them coming up. But so far, we haven't really experienced anything like that.
And that was the final question, if there's additional remarks.
Thank you, Dr. Bogan. And also, I want to thank Jackie, too. She sent me masks, and Greenfield's a special place to me because that's where my wife grew up. And these masks are wonderful. So, Jackie, thank you for doing that for the folks in the community. Let me also just kind of comment on some of the questions regarding the state and the governor and the restaurants, et cetera. So we're in constant communication with the state. As the second largest county in the Commonwealth. I know Dr. Levine, Secretary Levine, and Dr. Bogan and their teams are constantly comparing data, comparing notes on where things are happening, what types of things are happening, myself with the governor and his folks. So these numbers and some of the changes that have occurred, over this whole 6-month period with many businesses, not just the restaurants, but that question came up today, really is to be evaluated as we see the data and where the data goes. So we know that in many businesses, we've been able to see them open up safely and more safely as people, both the employees, the business owners, and the customers themselves all continue to kind of follow the advice of wearing the mask, social distance, all those type of things that need to have happen. So again, thank you as we enter this period with constant communication with our universities, our school districts, our businesses, and everybody to try to do the things we do. And thanks to the Restaurant Association for the self-certifying initiative that they're taking, again, working with Governor Wolf and his team and go from there. So everybody stay safe. Thanks.
I apologize. We have one more question. The press asked for a clarification. Dr. Bogan, could you tell us whether you have to be a Allegheny County resident to be able to get tested at the McKeesport site?
You do not have to be an Allegheny resident to be tested. It will probably be mostly Allegheny residents, but we are open. We have a lot of support for this from the Pennsylvania Department of Health, and so we want to be open and as inclusive as we can.
That ends our briefing. We'll be back for our next regularly scheduled briefing September 16th at 4 o'clock. There will be 2 releases for members of the media coming out following this briefing, along with the weekly COVID exposures information. Thank you for joining us.